An intracranial hemorrhage is bleeding within the skull, and this is obviously a neurologic emergency. ICH refers to bleeding within into the brain tissue or surrounding spaces, and it can lead to increased intracranial pressure, brain herniation, and ultimately even death. You want to remember these signs of increased intracranial pressure of papilledema, Cushing reflex, headache, and a lateral rectus palsy with ipsilateral mydriasis. There are types. There's cerebral or intraparenchymal hemorrhage, which is bleeding within the brain tissue itself. There's many causes, but hypertension and aneurysms, as well as AV, arteriovenous malformations, is some to note. And then a subarachnoid hemorrhage. This is bleeding into the subarachnoid space via the between the arachnoid and pia mater. Often this is due to a ruptured aneurysm where you'd see like that worst headache of life, neck stiffness, nuchal rigidity, and photophobia. Um, An epidural hematoma is where blood collects between the skull and the dura mater. This often is due to trauma and a tear in the middle meningeal artery. And there's kind of a classic like lucid interval followed by rapid disorientation. And then a subdural hematoma is blood between the dura and arachnoid mater, and this is often venous due to bridging veins. And this could be acute or chronic. We could see this in elderly or someone who is an alcoholic. An epidermal hematoma, we oftentimes blame our middle meningeal artery, like I mentioned, which is a branch of the maxillary artery. One piece to note is it does not cross suture lines. It'll bleed into the area between the skull and dura. There'll be transient loss of consciousness with a lucid interval followed by loss of consciousness again. It's oftentimes a biconvex hematoma that has a lens shape. And there could be an uncal herniation where there's an ipsilateral dilated pupil, and lateral rectus palsy. In subdural hematoma, due to bridging cortical veins, this bleeds into the area between dura and arachnoid. There's acute and chronic etiologies, and it creates more of a crescent-shaped hematoma. Subarachnoid hemorrhage due to rupture of saccular or berry aneurysms or an AV malformation. This is where we bleed into the area between the arachnoid and pia. This is the worst headache of life, the thunderclap headache, where there's neck stiffness and pain. Mental status will progressively worsen. And there typically isn't focal neurologic deficits. Those are more unusual. And blood will start to pool in the basal cisterns. Within a lobe, you can also have a hemorrhage. We call these intracerebral or intraparenchymal. You'll see signs of increased cranial pressure, for some focal neurologic deficits, depending on where the bleed is occurring. And this oftentimes is seen more in our elderly patients that have some sort of cerebral amyloid angiopathy. If we see a temporal lobe bleed, we could see an uncal herniation, and there is a reoccurrence rate that's relatively high. A lacunar hemorrhage also would be considered intracerebral or intraparenchymal. This is our Charcot-Bouchard aneurysms or hypertensive vasculopathy. The most common site is actually at the putamen, and the second most common site is the thalamus. If the internal capsule is affected, we'll see contralateral hemiparesis as well as hemisensory loss. If basal ganglia are affected, we could see signs like tremor, bradykinesia, chorea, rigidity, or altered mental status. In the germinal matrix within the ventricles, we can have a hemorrhage. This is often associated with a premature or low birth weight newborn. It would present a few days after birth with a bulging anterior fontanelle, new onset neurologic deficits, seizures, and in signs of increased intracranial pressure.